As a fitness professional, you know the joy of helping others, and you know it's more than just fitness. We're training the whole person. Wellness coaching provides expertise that goes beyond fitness and nutrition. It's a holistic approach to helping others become their best selves while reaching their goals. To us, there's no greater joy than that. Join the fitness leader. Become a fitness leader. Become a certified wellness coach. Go to nasm.org/wellness.
Hello, everyone, and welcome to Strong Mind, Strong Body. I'm your host, Angie Miller. Today, we are going to talk about gut health, nutrition, and mental health, and what is the hidden connection between them. I feel like we're hearing it more and more, how our food affects our mental well-being. And so let's really talk about that link. And today I have someone who has become a dear friend, and she is an expert that I just thoroughly admire. She was on last week, so this is the second part in our series. Her name is Dr. Nitaya Guin. Dr. Guin is a naturopathic doctor. She's also the founder of Deep Living, which is a wellness platform. But today we're going to talk about the hidden links between our GI issues, those gastrointestinal issues, our nutrient deficiencies, and our mental health. Dr. Guin is going to probably reveal some foods that could be sabotaging our mood and hopefully share some simple things that we can do that will transform our gut and our mind. So my goal is that this episode is going to revolutionize your approach to mental well-being. So Dr. Guin, I'm going to bring you in.
Good morning, Angie.
Well, it's good to have you back. Thank you so much for joining me on part 2 to talk about all things nutrition and mental health.
I'm so thrilled to be here, and I felt like we just reached the top of the iceberg on our last conversation. So excited to delve in deeper and give your viewers some options to really start getting their mood feeling better by supporting their GI health.
Yeah, 100%. And it really did. I mean, that episode was a lot to unpack. And so I feel like we've got even more to unpack this time. So let's go right into it. How can a seemingly healthy diet actually be destroying our mental health? I want to know the answer to this because I feel like that we all have this vision of what's healthy. And if you go to the grocery store, everything is healthy. And so there's always some coy label that makes something healthy, like whole grain. And then you look at the sugar content, you're like, oh, maybe not. So how can seemingly healthy diet be sabotaging our mental health?
Great question. So a seemingly healthy diet, well, first of all, most Americans are having a standard American diet, right? Which really isn't very healthy at all because it's focusing on carbohydrates rather than proteins and good fats. The standard American diet is really high in dairy as opposed to looking at healthy fats. So, kind of looking at how we decide what a healthy plate is in the first place is a very helpful place to start. How much of these different areas do we want to actually be eating? With that, we're told that normal foods are things like pastas and sandwiches and things that we get in boxes at the store. And I think that is a big and the first place to start is I think most people feel much better in general, regardless of what emotional concerns or GI concerns they have, if they eat less from a box and more from the earth. If we can stop processing our food so much and adding so many things to it and actually eat the vegetable, the nut, the seed, without combining it and taking nutrients out by putting it back together again, that is one of the first places to start. So redefining what a healthy diet is and how we then go grocery shopping, staying out of those middle aisles. We want fresh, organic, free-range meats, and we want lots of veggies and fruits and seeds and nuts and a lot less things out of boxes.
Yeah, I love the way you said that. Less from a box and more from the earth, because I think that's just a simple way of saying, right? If it's packaged, it's packaged. I don't care if it says multi-grain or whole grain or less sugar or gluten-free or all the things that it says, and everybody goes, oh, this must be healthy. But they're not, again, paying attention to how much sodium is in there, how much sugar is in there, all the things that make the food taste, quite frankly, very good and yet very unhealthy. So, so is there anything else you would want to say about that? Because you kind of described like what the plate should look like, but anything else like kind of warning signs when people think, oh, this is healthy, but it's really not. And there's so many misleading labels.
Yes, yes. So with that, you mentioned, when a label says all natural,
Mhm.
there are no rules around the term natural. Anybody, any business owner can say that their product is natural, and that doesn't mean anything. You can also put, flowers and pretty things on the label that make it look natural, and that doesn't mean it's actually natural. So you want to see terms like organic. You want to see the little symbols showing that it's verified. And with free range meat and grass fed meat, luckily in the last 6 months, there's been some changes to the rules around that as well. And now it's a much more trustworthy label. If the meat says that it's grass fed, it should say lifelong and give more information. Otherwise, you don't know if that animal was only grass fed the last week of their life. So there are some more stringent guidelines being put on these labels. But in the meantime, and just to be totally safe, getting a lifelong grass fed if you're going to get meat. With fish, getting Alaskan and fresh caught fish rather than farm raised. These are things to look for. And as I mentioned, with food that comes in a box, what we really want to look for, and you mentioned a couple of those, is what is the simple sugar content and what is the salt content, right? Because two of the main concerns health-wise in America are metabolic disease and cardiovascular disease. And so those are two big ones. Additionally, artificial colors, talk about brain health. Artificial colors, especially red 40, go across the blood-brain barrier, affect our electrical stimulation, and cause a rewiring. And you can look this up in research in NIH or PubMed. This isn't just my opinion. It's very well researched. There's a reason why ADHD has increased so much. The number of people who are autistic and various levels on that spectrum, artificial colors has a huge impact there.
Yeah. So I wrote down organic, and I wrote down verified, and I wrote down free range and grass fed meat. And then I also wrote down for fish, it would be Alaskan and fresh caught. Did I get all of that? I think
Yeah.
it's worth revisiting. And I think to your point, labels are just very, very confusing. And also there hasn't been a lot of legislation around how they label food. And so I do feel like we are often very misled in our society here in the United States, at least. That's the only place I can speak to. It's really, really hard. I see people a lot of times I'm walking down an aisle and I'll see like a mom just studying the label, and it's so confusing. And so my heart goes out because I'm confused and I read a lot. And so I know that all of us are kind of out there floating around going, wait a minute.
Absolutely. And that's why I like that you mentioned, the mom studying the labels. So if we avoid the boxed items altogether, that really helps with that frustration and confusion. The other thing is there are some wonderful apps like EWG, the Environmental Working Group, or Yucca, where they actually help you read your label and actually can look up ingredients and tell you whether they are a risk or not. So, not everyone wants to walk around the store with their app out, but if you do that when you're introduced to a food you think you want to have in your home, you could do it once and find out, is this really as safe as it says it is?
So you said EWG. What was the other app?
Yucca.
How
Yeah.
do you spell that?
YUKA.
YUKA. Okay. See y'all. I'm over here taking notes. Okay. I hope too. I'm taking notes because this is always good information, right? I am not the nutrition expert, but I sure do love to talk to naturopathic people and people who are the nutrition experts. So I have a question for you, Nitaya. What's the most shocking connection that you've discovered between gut health and mental disorders?
The most shocking connection for me is really the gut microbiome and neurotransmitters, specifically serotonin. We talked a little bit about this in the first episode. Is most people do not know that 90 to 95% of our serotonin is made in our GI lining. So the shocking thing to me is that, first of all, we don't know that. And then when we are treated for mood changes, mood disorders, doctors hardly ever mention what is happening with your GI health. And to me, knowing that 90 to 95% of serotonin is actually made in your GI system, before anyone talks about medications, or at least in combination, we need to be looking at how is your GI health?
Hmm. You know, I almost just want to take a pause because that's such a big one. Because let's be honest, you go into the doctor, you report anxiety or depression, there's a window that insurance is paying for. The doctor says, okay, take the depression scale, take the anxiety scale. Next comes medication. Maybe if we're lucky, mention of talk therapy if we're lucky, if it's a
Yes.
good provider. Not always and not as often as I'd like. And then, but what about the GI function? What about what's going on in the gut? And with as much as I know, how often do any of us really hear about serotonin in the gut? We hear about serotonin in the brain, right?
Yes.
So what would you advise then if somebody goes in and they're like, I'm experiencing depression or I'm experiencing anxiety? If you had your pie in the sky dream for how regular general practitioners would treat this, what would you want them to ask?
Thank you. And I love that you mentioned traditional providers, because it's mostly MDs and DOs who can take insurance who are seeing patients with mood changes or possible mood disorders. And so giving the providers more tools is really important. And that's why so many MDs and DOs get additional training in integrative and functional medicine. And that's why naturopathic doctors are trained this way to begin with. So a tool that I would like doctors to have is to, instead of just looking at what are your symptoms like right now, and then, okay, we have a medication for that. When did these symptoms start and what are they in connection to? So looking at every system of the body, not just the GI system, but that would be, once you get the questions about what the person is going through mentally, when we know, when did anxiety start, when did it get worse, what have you tried for it? Once you get through those questions, the very next set of questions should be, how is your GI health? Do you go to the bathroom regularly? Do you feel bloated every time you eat? Do you have a possible IBS, which is irritable bowel syndrome, which can be constipation, diarrhea, or a swing back and forth of both? Do you have acid reflux every time you eat? If any of these symptoms are happening or happening chronically, then most likely your microbiome is very unhappy. And if this is someone who's also had to be on a lot of antibiotics for a different health concern, then their GI lining could be completely wiped out. So this is an area I would love doctors to get more training in so that they can start here. There's often an increase in anxiety or depression when a GI problem happened.
Yeah. Well, and to your point, you already asked a lot of questions that I'm not sure they even get asked because I'm not sure that a lot of providers are even digging deep enough to say, when did it start? Do you know, kind of the precursor to this? Is there something going on in your life? What has changed? And then the big one is, what have you tried? What have you tried so far? And what have you had success with in the past? You know, if you've had periods of anxiety or depression in the past, did you or were you able to find something that worked for you then? Does it work for you now? What might be different? There's so many questions, but in defense of providers and insurance, I realize that for the sake of time, there's not a lot of time during these appointments. So I think that, Nitaya, this is good why we have people like you out there in the world where we can, as individuals, kind of be our own advocate and say, I might need some help. But how many people actually think, oh, my bloating might be related to this, or the fact that I'm constipated, or I'm going 5 times a day, or, my gut's just never happy, or I'm not sleeping very well. There's all these layers of things that affect our mental health. So, is there anything else you would say in line with that? Or maybe because what I feel like you just did was, even if the provider doesn't ask the questions, you've given us questions, or how should I say, information that we could share with our providers, right?
Absolutely. Yes. So sharing that with your provider, but also trying to see a provider who's trained to understand, because if you may know more than your provider does, if you're sharing what's going on with your GI health, they may not necessarily have the tools to help with your GI function. So most doctors know that many people feel better going on a probiotic right after antibiotics. Most providers know that we will feel mentally better if we have less IBS symptoms, but it's the details where it gets challenging. And so a very simple tool that I'd like to offer to our viewers today is we talk about serotonin and it being made in the GI lining. One way to really raise serotonin is to eat more foods with tryptophan in it. So most of us know about turkey because we get so sleepy after eating a ton of it at Thanksgiving. But there are seeds that are wonderful. They're very high in tryptophan and very good at transferring into serotonin. So I really like to share this with people because just as we talked about eating more from the earth and less from a box, I really like to think about the hunter-gatherer mindset. And the gatherer ate a lot of seeds and nuts and berries. And we know these are very high in antioxidants, in omegas, in protein. And so the seeds that are high in tryptophan that then gets converted into serotonin are pumpkin, sesame, and sunflower. So if you're not thinking about adding seeds to your food, this is a wonderful, easy way to support your GI health. It
Hold on, I
increases
got to run to
fiber.
this. Those are the 3 seeds I don't have. Wait, I don't have pumpkin, sesame, or sunflower. Darn it. Can we pause this episode? All right.
And that's why I mentioned those, because luckily we're starting to hear a little bit more about chia seeds and flax seeds. And I would love if we all had more of those as well, because they're great for building our female hormones and male hormones. Okay, chia seeds are wonderful for testosterone. We talked about those the other day. But pumpkin, sesame, and sunflower specifically are high in tryptophan. So getting more of those in your diet can help you make more serotonin.
Okay. Well, all right. And I like to find those in the raw form because I don't want the sodium. So I try to find those in the
Yes,
raw form. Is that a good thing?
absolutely.
Okay.
You're right.
And then the chia seeds, quick question, quick pivot on this whole flaxseed thing. I use ground flaxseed, not like the seed. Is there a difference for those of us out there who do the ground versus regular flaxseed?
Yes, first of all, I like it better the way you do as well. So I think flax seeds, when they're ground, I think they taste better, and you can put them in all kinds of foods, including baking and smoothies and things like that, and not just on top of food. But I do like to buy smaller bags and so that they're fresh, because when they're ground up, they oxidize more quickly, which is similar to nuts. It's better to get smaller bags and make sure to eat those in about a month than having them on the shelf for 6-8 months. So same thing with flax, but I prefer the taste of it ground as well. And as long as it's not exposed to oxygen for longer than is ideal, then it works very similarly.
I store mine in the fridge. I don't know. Is that good or bad?
Perfect.
All right. Very
Yes.
nice. Something right. Okay. So is it possible? Well, before I even ask you this, I want to reintroduce. So my name is Angie Miller. This is Strong Mind, Strong Body. And I'm so excited that you joined us for this episode because I have Dr. Nitaya Guin. We're talking about gut health, nutrition, and mental health. And what is that hidden connection? Nitaya is just a wealth of knowledge. And this is part 2 of our series on all things mental health and nutrition interrelated. And so, Nitaya, my question to you is it possible that common medications that improve mental health symptoms could be worsening our gut problems? And is that just creating this vicious cycle?
Absolutely. There is a vicious cycle there. And that's why it's so important to look into why the mental health concern is happening before getting put on a medication. And so SSRIs, serotonin um, uptake inhibitors, they in general can cause GI upset. And there's a few that are really wreak havoc on the GI lining and disturb the microbiome. Fluvoxamine is the main one, and sertraline or Zoloft is another one. These are very commonly given, and they cause nausea, constipation, diarrhea, can increase the risk of ulcers. So there's absolutely a vicious cycle, because now you're on this medication and you need to, if you want to try to reduce it, then you need optimal GI health and increase serotonin and dopamine to be able to reduce and adjust that medication. But now you've completely wreaked havoc on your GI lining and the microbiome is disturbed. So there's absolutely a vicious cycle there. So many of the patients I work with, when their goal is to come off of a medication, we have to be very gentle and very careful about doing so. First, increasing the nutrients that medication might deplete, first of all, and then really making sure the GI lining is as healthy as we can possibly make it while they're still on the medication. That way, when they come off of it, they'll feel better more quickly and have less of a withdrawal and we don't want to risk having worsened anxiety or depression while coming off of a medication. So my whole treatment plan is around supporting gut health. For some people, also supporting hormone health, as we talked about the other day, but gut health first.
Well, and that makes total sense, because it's like ripping off the Band-Aid before the wound is healed. And so part of the wound is getting the gut health in better shape, so that when you come off the medication, you taper off it slowly, you at least have a protective barrier, so to speak, of having a healthy gut before you go there. So I'm glad that you talked about that, because I do think that that's something that we don't always know about, is that some of those medications for mental health can in fact cause this vicious cycle. And so it's not that I don't hear you say, Dr. Guin, I don't hear you say go off your antidepressant. What I hear you say is there could be a link, and it might be something you want to talk to your provider about, right?
Absolutely. Depending on the person, the interventions for our health can be as simple as lifestyle changes, food changes, and supplements. For others, medications are necessary. So it depends on the person and their health. Sometimes my support is more adjunct, and other times it's more central. And I love when teams work together. Doctors' offices where you have a nutritionist and a doctor, or a naturopath and an integrative doctor. These are my favorite types of clinics, where providers work together and put the patient at the center of their care. And some of those offices do take insurance, so you don't always have to go outside of that realm to get that care.
Right. Just a collaborative approach, or wraparound services are so important. And I do think we're seeing more and more wraparound services. I do think we're seeing more and more collaborative approaches. I think sometimes they come with, fees and so on. But what those fees give you is, again, that whole holistic approach. So what do you think, Dr. Guin, are there nutrient deficiencies that you think could be sabotaging our mood and our cognitive health?
Absolutely. We mentioned a couple of these at our last talk. And so I want to say those first, because these are also building blocks for hormones, for estrogen, progesterone, and testosterone. And they are the two most common deficiencies that affect our mood. They are vitamin D and B12. So starting with those two, if you're not sure if you're depleted in those, you think, hey, I get enough sunshine, or I must be fine for vitamin D, or I must be fine in B12 because I eat meat. We don't know how our vitamins are transferring once they're inside of our body. So labs are a wonderful tool. If you don't know, get a baseline, find out if you've never known what your vitamin D or your B12 are. But also, if you don't want to do labs and you just want to go off of how you feel, if you have a very healthy GI system, you go to the bathroom regularly each day, you don't have issues with bloating, pain, discomfort with certain foods, you have good energy, then you can assume your levels are probably adequate. But for most of us, that's not the case. And I've had people ask, well, do I get these vitamins in my food? Do I get them in supplements? Do I get an IV? It depends on the person and how you absorb your nutrients. So some people are really against IV nutrients. They say, well, just eat it, just get it in your food. But for people who have irritable bowel syndrome or worse, may have Crohn's, ulcerative colitis, or just have had a lifelong issue with constipation or diarrhea, they may not be able to absorb their nutrients very well. So starting with IV nutrients is a wonderful option. And as the lining heals, then you move more into getting it just in supplements. And for people who have an impeccable diet, they don't have to take a multivitamin. I don't recommend a multivitamin for everyone, but how we're trained in society and growing up with a standard American diet, many people need the additional nutrients until their system is very good at absorbing their food. And some of the things that make it so we don't absorb our food as well are toxins that cause increased gap junctions in the GI lining. And we've often called this leaky gut. So things like gluten get a bad rap for doing that kind of disruption. And it's very true. So I'll just speak to gluten for a moment, because so many people are trying not to have gluten at all or to have less of it. And for many people, that is a very good idea. And partly because it's been so genetically modified over the years, but also there's all this research in the last year on exorphins that gluten emits, and they cross the blood-brain barrier. And I wanted to mention that because we're talking about mood and we're talking about cognitive health. And some of the things that we eat, we hear they cause inflammation. We hear they could be a problem, but we don't really understand why. And gluten specifically can cause inflammation in the GI tract, but those exorphins also go to the blood-brain barrier and change our electrical stimulation, hence causing brain fog mostly.
So, I do want to say something about the whole gluten thing, though. The issue that I see with the whole going gluten-free is, again, go down the grocery store aisle. I will see the craziest unhealthy food, and it will say gluten-free. And so it's popping into people's carts because
Yes.
that's the key word, gluten-free. I'm not even sure everyone knows what gluten-free is or what that means or anything else, but they hear that gluten-free is better. So they throw it in the cart, but it's full of sugar and stuff to make it taste good. And I'm like, oh, I think we're missing the point here. So we do things to make food healthy, and in doing that, we make it unhealthy, right? It's crazy.
Exactly, Angie. I love that you mentioned this because, yes, first of all, gluten is in wheat or flour, and it's hidden in all kinds of things. It's in soy sauce. It's very hard to completely eliminate gluten. So that's a whole nother area. But I love that you just mentioned all the gluten-free things that are really bad for us. They're full of corn and sugar and preservatives and salt. And so an area I really try to work in is, instead of finding gluten-free alternatives that remind you of the gluten food, so instead of trying to get gluten-free bread or gluten-free pancakes or gluten-free pasta, can you just choose a different food? So, for example, in our household, we eat a lot of quinoa. Quinoa is a perfect protein. It has every essential amino acid in it. We do quinoa instead of pasta most often now. I have 3 kids, so I'll be completely honest. Every once in a while, we do a brown rice pasta or a chickpea pasta because they miss it and they want to have foods that remind them of sandwiches and pasta. But for the most part, it goes back to, can we get our food more from the earth, less from a box? I'd rather have lentils or quinoa than fake pasta.
Okay. Yeah. I think that makes a lot of sense. And again, I feel like you and I have had 2 episodes that could be 20 episodes. There's so much to cover here. But I think that you're doing a spectacular job of kind of laying out some of the big culprits, like red flag culprits when you're going down the aisle at the grocery store. Dr. Guin, I have one final question for you. What's the single most impactful dietary change that someone could make to revolutionize their gut and their brain or their mental health?
That is a great question. So, to me, the most important thing to do is actually get artificial colors out of your food. As we mentioned in this episode, artificial colors, red dye 40 more than the others, but the others as well, they literally go right to the brain and cause dysfunction. And the reason I mention this is because we see these artificial colors in foods that are even considered healthy to most people. We see them in sports drinks, in protein bars, not just in candy. So it isn't just a matter of, okay, I'm going to stop having Skittles. There was a whole thing about Skittles last year, and they had to change their formula because it was considered poison. Not just it's not healthy, but it's actually dangerous, right? So yes, let's keep out some those types of foods, but we also need to look at our sports bottle labels and our protein bars and make sure that there are no fake dyes in those.
What would be the names that they could look for besides red dye 40? Are there other names that it could be hidden under as far as dyes?
They're usually written just as that, so they're actually really easy to find.
Okay.
So they're not usually hidden or confusing. You will see red, yellow, blue, and a number next to it.
Okay. All right.
Okay. Some of the ones that are a little bit more challenging to find are actually in our products that we put on our bodies. So that's a whole nother topic, is the environmental toxins and what we're putting in our skincare and our hair products and things like that, where we want to keep out phthalates and BPA, less things in plastic. That goes for food as well. And less fragrance. Fragrance is an endocrine disruptor, and it's in a lot of things that we still use because we like the smell and the label says natural. But actually getting fragrances from the fruit or flower rather, and having it just say the flower name, that is safe. Whereas if you see fragrance, it is not necessarily safe and can be an endocrine disruptor.
Oh my goodness. I think we just unpacked our future 10 episodes. Dr. Guin, if people want to get a hold of you, how would they reach you if they have any questions?
People can reach me on Instagram messages at Dr. Nitaya Guin. You can also go to my website and find some of the things that we've talked about today, like supports for labs. See some of my other articles. You can see my skincare and wellness line, which is organic and vegan and all the things that I care about. So that's drnitaya.com.
All right. Thank you so much. Hey, thanks to all of our Strong Mind, Strong Body listeners. I'm so glad you joined us on this series about this whole connection between our mental well-being, our gut health, and our nutrition. So thank you again to Dr. Nitaya Guin. Thanks to all of you for tuning in, and I will see you next week.